Knock before entering room. Hi, Mrs. Smith, how are you? My name is Shay, your student nurse aide. I am here to assist you on your bedpan. Is this a good time? The 5 steps. Now, before I get started. First, allow me to wash my hands. Second, lock the wheels on your bed. Third, pull your privacy curtain. Fourth step is to make sure your bed is at a safe level. And fifth and final step is to make sure your call light is within reach. Now allow me to gather my supplies. Use the bedside table to put your supplies on to avoid cross-contamination on your uniform. Use a towel as a clean barrier to cover bedside table. Get 2 pairs of gloves. Place the clean gloves on your bedside table. Please note, never place the bedpan on a bedside table. Grab an incontinent pad to place under bedpan. Make sure you do not pick up bedpan without gloves, and do not place bedpan on bedside table. Next, you will need hand wipes to give to patient after they are finished. Place the toilet paper on the bedside table within patient's reach. Inform patient that supplies will be within their reach. Don gloves. Wear gloves snugly but not too tight, ensuring they cover the wrist. Place the incontinent pad on bed with the bedpan on top of pad. The widest part of the bedpan forms to the widest part of the buttocks. Have patient bend their knees and lift their hips on a count of 3. To place bedpan and pad as a whole unit, 1, 2, 3, lift hips. Lift the sheet to expose only the hip area with minimizing exposure. Slide the bedpan under the buttocks, ensuring it's positioned comfortably and securely. Make sure the wide end is aligned with the lower back and the narrow end toward the legs. Adjust as necessary. Take off gloves and wash hands. Place gloves in trash. Make sure call light is still within reach. Ask the patient how high they want the bed raised. Adjust it slowly, observing their facial expressions and feedback. Ensure clear communication and explain each step as you go. Place remote on hook. Please note, no one lays down on toilet to use restroom. Make sure your patient is comfortable and then place the bedside table next to them, making sure their toilet paper and wipes are within reach. Instruct the patient to use toilet paper for her buttocks and wipes for her hands, giving her a wipe when you return. Give patient privacy. Walk to other side of curtain. Let client know to push their call light when done, and you will be back to assist. Return to the room after the patient presses the call light, wash your hands, ask if everything is okay, and put on gloves immediately. Wear gloves snugly, but not too tight, ensuring they cover the wrist. I like to use the phrase, gloves on, bed down means to put gloves first, then lower the bed. Ask the patient if they use their toilet paper to wipe their buttocks. Give patient hand wipe to wipe their hands, then toss wipe in the trash. Now you can put toilet paper and wipes in bedside table drawer. Now that the patient head is down, you can slide out the bedpan by instructing the patient to bend their knees and lift hips on a count of 1, 2, 3. Remove the bed pad under the patient along with the bedpan. Place the incontinent pad in the dirty linen and take the bedpan to the bedside commode and pour away from you. Go to the sink, add water to the bedpan, go back to the bedside commode, swish lightly and pour away from you again into the toilet. Then grab a paper towel and dry bedpan thoroughly. Place the clean bedpan into the bedside table. After placing towel in dirty, you must take off your gloves without contaminating yourself or bedside table. Always wash your hands after removing gloves. During the skill test, you can indicate and verbally state that you're washing your hands. Now for indirect care, ask the patient if they want bedside table near them, TV on, or privacy curtain open when done. Look at your skill list, wash hands again, and state, "My skill is complete."